Hello, I'm Laura Jost with the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. This week, the Senate Finance Committee suspended its rules and cleared Georgia Congressman Tom Price to be the new Secretary of Health and Human Services. Republicans cleared Price after Senate Democrats boycotted a committee vote the previous day. Democrats said both Price and Treasury nominee Steve Mnuchin had misled them during their initial hearings. Price has drawn scrutiny over stock trades that appear linked to bills he had sponsored, including an effort to block a bundled payment program for joint replacements. Finance Committee Chairman Orrin Hatch called the Democrats idiots and said, "This is the most pathetic treatment I have seen in my 40 years in the United States Senate." President Donald Trump told leaders from PhRMA, which represents the nation's drug makers, that he wants to use trade policy and tax breaks to bring down drug prices and bring jobs back to the United States. Trump met with the leaders of PhRMA at the White House after saying a few weeks ago that the drug industry was getting away with murder. As a candidate, Trump called for letting consumers buy imported drugs to save money, but at this week's meeting he blasted what he called global freeloading by countries that benefit from U.S. innovation. Said Trump, "I'll oppose anything that makes it harder for smaller, younger companies to take the risk of bringing their product to a vibrantly competitive market. That includes price fixing by the biggest dog in the market, Medicare, which is what's happening. But we can increase competition and bidding wars big time." Trump's complaints about price fixing came the same week that a group of patients with diabetes filed a class action lawsuit against the top three makers of insulin. The lawsuit, filed in a federal court in Massachusetts, accuses Novo Nordisk, Sanofi, and Eli Lilly of manipulating insulin prices and offering discounts to pharmacy benefit managers at the expense of consumers. Some patients in the lawsuit say they must pay $900 a month to stay alive and have taken measures that harm their health to avoid using too much insulin. The lawsuit says, many patients describe rearranging their lives around their insulin costs, keeping lights off and the heat low to avoid high electric bills, moving back in with their parents, and even leaving school. Officials with Novo Nordisk and Sanofi said they will fight the lawsuit, and Eli Lilly said it maintains the highest ethical standards. A new study from Discern Health found gaps in the current quality measures that accountable care groups use for treating 10 cancer conditions. The study found the measures used don't match the most common cancer conditions, measures don't match specific conditions, and measures don't address gaps in multidisciplinary care, such as getting access to clinical trials, genetic testing, or palliative care. Finally, a new study from the University of Pennsylvania finds that stress from fat shaming can raise cardiometabolic risk in obese patients who are trying to lose weight. Dr. Fatima Cody Stanford of Harvard previously told AJMC how improving patients' self-worth is often the first step to overcoming obesity.
Often when I see patients that come in and they're accusing themselves of being fat or looking at themselves with derogatory language, I have them change the language that they use themselves to talk about themselves before we continue with our appointment. Because I think it's important for not only me to say that to them, but for them to begin to believe that themselves. And it's usually undoing a lifetime of issues that they've been called names and they've started to believe these names. And you know, if they believe that, it's going to be harder for us to make progress in dealing with their disease process.
For all of us at the Managed Markets News Network, I'm Laura Jost. Thanks for joining us.